Hi, this is Dr. James Hutcherson again, and we're going to talk Chapter 7, the skeletal system today. So let's delve right into it. I'm going to share my screen with you with the PowerPoint images. And remember, these are available to you on your Moodle site as well. Okay, so let's just start with a general overview. This chapter is going to go over just some general terms at the beginning, and we'll talk a little bit about the tissue biology as well as a little bit of physiology, and then we'll get into the specific bones of your system. So let's go right into that. Okay, so we actually say that the bones really are the organs of the skeletal system. And that makes total sense when you think about that definition again, going back to the first chapter on organs. And remember, an organ is a group of tissues working together for a common function. And there's actually several different types of tissues that you will see when we talk about skeletal system, not just bone tissue. But for skeletal system, we're also talking about cartilage and dense connective tissue, and also blood and nervous tissue. And all of this stuff really is alive and has many functions. Okay, so your bones are definitely alive. They support and protect the softer tissues. They're used for movement. Skeletal system is also important for blood cell formation. I think this is one really important fact that many people forget. And then minerals. We divide the skeletal system into two divisions, the axial and the appendicular. We'll come back that basically the axial is down the middle and appendicular is everything connected to that. The bones of the skeletal system vary greatly in size and shape, as you very well know, as you look at a skeleton. And bones are very similar, though, in certain features, though. I mean, general structure, we'll get into that, and how they develop and their functions. So first, we can classify bones by their shape. So we can talk about long bones, which are long and narrow. They have expanded ends. That's kind of the typical bone that most people think about. And then you have short bones, which are more cube-like, or their length is equal to their width. And this includes what we call sesamoid bones or round bones. And these are often embedded in the tendons. The flat bones, which are plate-like, and they have very broad surfaces. And then irregular bones. So that's all the others that don't fit neatly into the other shapes. And most are connected to several other bones. Okay, and this shows you those different types here. Right? This is definitely long bone, right? Here we have, of course, sesamoid. Here we're going to have more of the flat bone. And then here we have some of the irregular shaped bones. Okay, some general names for different parts of bones. The epiphysis is the expanded end, and the diaphysis is the bone shaft itself. The metaphysis, this is between the diaphysis and the epiphysis. Those are the widening parts. Then we have the articular cartilage that is at the ends. And that covers the epiphyses. The purpose of that is for making sure that when the bones rub against each other, that they definitely have a frictionless surface, which is going to be important for keeping bones from deteriorating at those ends. Periosteum, this encloses the bone. It's the dense connective tissue, actually, that covers the bone. Then we get right into the bone tissue, the compact or cortical bone. That's the wall of the diaphysis. Remember, the diaphysis, again, is the long part of the bone. Then we have spongy cancellous bone that makes up the epiphyses, the ends of the bone, the expanded parts. And when you look into the epiphyses especially, you'll see trabeculae, which are these bony plates, cross sections of spongy bone. Looks kind of like thickened spiderweb areas. The medullary cavity is the hollow chamber that goes down the middle of the diaphysis, and it has the bone marrow. The endosteum is the part that lines the spaces or the cavity of the bone, around the bone marrow. And speaking of, the bone marrow is red or yellow marrow. It lines the medullary cavities and also the spongy bone spaces. We'll talk more about that later. Okay, so this shows those parts. Again, the middle part's diaphysis, the ends are the epiphyses. The proximal epiphysis is the part that is closer to the attachment point, of course. The distal epiphysis is on the other end. Okay, this shows you that spongy bone at the epiphyses, and that contains red bone marrow in there. Yellow bone marrow is down the middle where we have the medullary cavity. Again, you have compact bone that lines the outer part of bone. And then you also have a little bit of the spongy bone, then the endosteum, which is the lining of the interior. Okay, the periosteum is the outer layer. And remember, again, that is some connective tissue. It's a dense regular. Okay, looking at the microscopy of the bones, osteocytes are the mature bone cells. And within the bones, when we look closer at them, we find that the osteocytes are actually found in these little chambers called lacunae. And then to connect those lacunae, we have canaliculæ. Those are passageways. And that's the way the osteocytes exchange the nutrients and waste. Then the extracellular matrix of the bone, that's largely collagen fibers and inorganic salts. Pardon me. And then the collagen gives the bone the resilience, and the inorganic salts make the bone hard. Okay, compact bone, a little more detail here, consists of cylindrical units we call osteons. They look kind of like targets. Really, we'll show this in a minute, bullseyes. Osteons and layers of matrix and lamellae, they cluster around the central canal in each osteon. Very strong, very solid type of material. And it needs to be because this is the weight-bearing part of the bone. It resists compression. Now, spongy bone consists of branching plates we call trabeculae, which I've mentioned before. It's a little more flexible, and it has spaces in it between the trabeculae that reduce the bone's weight. But at the same time, those are areas that do allow for some storage of marrow. And this is a cross-section of some of the real bone where you can see the spongy bone and you can see the compact bone. And you even see that again in flat bones. In the middle, you have the spongy bone. On the outer edges, internal and external, the compact bone. Okay, this shows what an osteon looks like if we look at compact bone. Again, notice that you have lacunae, which are these areas or chambers where you find the osteocytes, and they are arranged in these concentric circles with canaliculæ that are connecting those. And here's a cross section or close-up showing the canaliculæ linking those lacunae or the osteocytes. Okay, and as we move into the center of the bone, you'll see more of the spongy bone. And again, it does have plenty of blood vessels, but it's a little bit different than those connections we see, like the perforating canals within the compact bone. Okay, major functions of bones. They provide shape to the body, of course. They support the body structures. They protect body structures. And they help with body movements, obviously. They do contain tissues that produce blood cells, and they store the inorganic salts. Okay, bones provide shape for your head and your face, your thorax, your limbs. And one of the reasons why your face looks like it does is because of the bone structure. Bones do support the body weight. You have the bones of the lower limbs and the pelvis and the vertebral column that support us. The skull bones, they protect the brain, the ears, and the eyes. Bones of the rib cage, shoulder girdle protect the heart and the lungs. Bones of the pelvic girdle protect the internal reproductive organs and the lower abdominal organs. And the bones and muscles do provide movement. Now, we said that blood cell formation is an important part of bones or skeletal system, and we call blood cell formation hematopoiesis. Blood cell production does occur in the red bone marrow, you might have guessed. Red blood cells, white blood cells, and the platelets are produced in the red bone marrow. And as you age, some of the red bone marrow then gets replaced by more yellow bone marrow. The yellow bone marrow stores fat, but does not produce blood cells. Red marrow remains in the adult in the skull and the ribs and the sternum, also clavicles and the vertebrae and the hip bones. Bone marrow transplants can be done to treat many different conditions. Okay, we said that one of the functions of the skeletal system is for inorganic salt storage. And about 70% of bone matrix consists of the inorganic mineral salts. Most abundant salt is called hydroxyapatite, you might have guessed, calcium. But really the molecule, the compound is calcium phosphate. Now there are other salts also that include magnesium and sodium and potassium and carbonate in the skeletal system. Now these areas do sometimes degrade. We call that osteoporosis. And that's when you have a loss of bone mineralization. And calcium is really important in nerve impulse conduction and muscle contraction. So blood calcium levels is going to be regulated. And again, the way we regulate calcium is by its storage in the bone or release from the bone. And it's being regulated by parathyroid hormone and calcitonin. You'll learn more about that in Biology 169 when you talk about the endocrine system. This control is a negative feedback mechanism. As we notice that the normal blood calcium levels are too low, blood level decreases of the calcium. You have receptors in the parathyroid gland that sense this decrease in the blood calcium. Then the parathyroid gland releases parathyroid hormone. It actually causes these special cells in your bones called osteoclasts to break down. They release calcium, so that's a natural process. Then the blood calcium levels do return to normal. Now, if the calcium levels go above normal, then the receptors, cells in the thyroid gland, sense this increase. They release calcitonin. And the osteoblasts now deposit calcium in the bones. So we store more of the calcium and we return the blood calcium levels to normal. So again, we're talking about parathyroid hormone and calcitonin, which are the two hormones involved in regulation of the calcium levels. Let's talk a little bit about bone development and growth and repair. So parts of the skeletal system, oops, sorry about that. Going the wrong way, here we go. Okay, that can be a little sensitive sometimes on the mouse. Parts of the skeletal system begin to develop in the first few weeks of prenatal development. The bony structures will continue to grow, they'll develop into adulthood. And bones form when the bone tissues replace the existing connective tissue in one of two ways, either intramembranous ossification or endochondral ossification. And so bones made by these two different processes we can either call intramembranous bones or endochondral bones. Okay, the fetus at 14 weeks of development will show growth of both intramembranous and endochondral bones. Intramembranous ossification, this occurs with the flat skull bones, the clavicles, the sternum, and some of the facial bones. Bones will form between sheets of primitive connective tissue. So it starts with that primitive connective tissue. Endochondral ossification, this is what forms long bones in most of your skeleton. And at the beginning of this, you actually start with hyaline cartilage as what forms the bone to start with. So you basically have a hyaline cartilage skeleton, and then it ossifies. Okay, osteogenesis imperfecta, this is a hereditary collagen defect where the bones are brittle. The fetus can have a lot of bone fractures, unfortunately, in that particular problem or disease. And this shows bone development in the fetus. So again, that skeleton is pretty much hyaline cartilage to begin with. Okay, intramembranous bones, they originate within sheet-like layers of connective tissue. So we're talking about broad, flat bones like the skull and clavicles or the sternum, and some of the facial bones like the mandible, the maxilla, and the zygomatic bone. Intramembranous ossification, this is the replacement of embryonic connective tissue to form intramembranous bones. So the mesenchymal cells in the primitive tissues differentiate into osteoblasts. Osteoblasts are the bone-forming cells. And we mentioned these earlier when we talked about regulation of calcium. So anything that ends in blast means it forms something. A clast, on the other hand, breaks down something. But again, back to this point, the bone-forming cells that deposit the bone matrix around themselves are the osteoblasts. And when the osteoblasts are completely surrounded by the matrix, then they are now osteocytes in the lacunae. So they're the operating cells. Mesenchyme on the outside will form the periosteum. Okay, this shows that process of intramembranous bone formation. You see the ossification centers. We see laying down of the calcium bone matrix, eventually the trabecula form, and here we are with the flat bone finally, with developing periosteum and spongy bone and compact bone. Okay, endochondral bones. Again, this is most of the bones. They begin as hyaline cartilage, and this is most of the bones of the skeleton, like your femur and the humerus, the radius, the tibia, phalanges, and the vertebrae. In endochondral ossification, again, this is where we replace hyaline cartilage to form the endochondral bone ultimately. And it begins as hyaline cartilage again. And cartilage cells are called chondrocytes. So they enlarge and the lacunae grows. That's the chamber opening. The matrix breaks down and the chondrocytes die ultimately. Then the osteoblasts invade the area. They deposit the bone matrix. The osteoblasts form spongy bone and then compact bone. And once they're encased by the matrix, osteoblasts are now osteocytes. Again, your regular functional cells. So if we look at the formation of, say, a long bone, it begins as a hyaline cartilage model. You have a primary ossification center, and this is the area in the center of the diaphysis where the bone tissue will replace the cartilage initially. Replacement with the bone tissue will then proceed towards the ends of the bone, towards what's going to be the epiphyses. The osteoblasts from the form the periosteum. Let me try that again. The osteoblasts from the periosteum will deposit the compact bone around the primary center. The secondary ossification centers develop. These are areas of the epiphyses. This is where spongy bone forms later in development. And then the epiphyseal plates, that's the band of cartilage that will continue between the ossification centers. And you usually will see that band at the very end. So as we see this formation here, these epiphyseal lines will stay there where originally we had an epiphyseal plate. We often know a person has stopped growing once the epiphyseal line is seen, or the epiphyseal plate no longer is developing new bone and therefore lengthening the bone. Okay, here we can see the epiphyseal plates in a child's hand. So that actually shows us, since it's kind of open like that and a little bit wider, is that there's still growth. Okay, table 7.1 is a good chart to remember in comparing intramembranous ossification and endochondral ossification. Okay, we talked about the epiphyseal plate. This is where long bones lengthen. So in the growing long bone, the diaphysis is separated from the epiphysis by the epiphyseal plate. And this is the region where the bone grows in length. Cartilaginous cells of the epiphyseal plates will form 4 layers. So first you have a zone of resting cartilage. That's a layer closest to the end of the epiphysis. Then you have the resting cells. Okay, they anchor the epiphyseal plate to the epiphysis. Okay, next we have the zone of proliferating cartilage. Rows of young cells occur here, and these are undergoing a lot of mitosis. Then we move into the zone of hypertrophic cartilage. Rows of older cells left behind when the new cells appear in this area. Thicken the epiphyseal plate, lengthening the bone. Matrix calcifies here, cartilage cells or the chondrocytes die. And then you go to the zone of calcified cartilage. You have a thin layer of the dead cartilage cells, and this is where the matrix is calcified. Okay, this cross section shows where you have these different zones. And these are the epiphyseal plates. Here's an actual microscopic slide showing those areas. They're pretty distinct. Again, this is happening up at the epiphysis. That's where lengthening occurs of those long bones. Okay, the osteoclasts do break down calcified matrix eventually in the epiphyseal plates, and then the osteoblasts invade and replace the cartilage with bone tissue. The bones, though, can continue to grow in length as long as the cartilage cells of the epiphyseal plates remain active. When the ossification centers do meet and the epiphyseal plate ossifies, then bone no longer grows in length. And the bone can thicken by depositing compact bone on the outside and under the periosteum. And this shows some of the bone resorbing osteoclasts. Okay, this shows the ossification timetables. And you might want to take a look at this. It follows through the different age levels of when different things are occurring and when finally you stop growing, basically. So here it shows basically for females, by 23 years of age, females' bones have completely ossified. For males, it's not until age 25. Okay, but it depends on which bones you're talking about, because some of the bones will ossify sooner than other bones. Okay, so bone tissue does ossify eventually, as we said, and then the bones are still going to have some of the major functions occurring well later into life, like basic homeostasis. During development of the intramembranous and endochondral bones, osteoblasts and osteoclasts reshape, they remodel. Bone remodeling does occur throughout life, okay, because those cells do not last forever, so we have to do some replacement. And you have opposing processes of deposition and resorption that occur on the surfaces of the endosteum and periosteum. You have bone resorption, which is removal of bone by osteoclast. So that's when we need to release more calcium to be used in your system. And then bone depositions when we have extra calcium, so we're going to form more bone by the osteoblast to basically store calcium. 10 to 20% of the skeleton is going to be replaced each year, believe it or not. Okay, factors affecting the bone development, growth and repair: nutrition, sunlight exposure, hormone levels, physical exercise. All of these things affect the bone development, growth, and repair. So vitamin D specifically helps with calcium absorption. A deficiency will cause rickets or osteomalacia. Vitamin A, the osteoblast and osteoclast activity does affect the vitamin A. Deficiency of vitamin A will retard bone development. Okay, vitamin C, that's important for collagen synthesis. A deficiency is going to result in slender, fragile bones. Growth hormone, this stimulates cartilage cell division. Any insufficiency in the growth hormone in a child can result in pituitary dwarfism, and excesses can do the opposite, causing gigantism or acromegaly in adults. Thyroid hormone causes a replacement of cartilage with bone in the epiphyseal plates and the osteoblast activity. The parathyroid hormone stimulates osteoclast and bone breakdown. Sex hormones like estrogen and testosterone promote bone formation and stimulate ossification of the epiphyseal plates. And then just basic physical stress will stimulate bone growth. That's one reason why they say that continuing into adulthood and older, it's important to continue stressing your bones so that you have continual replacement of bones and strengthening of bones. Otherwise, they're more likely to degrade. And this is kind of an interesting comparison here. Here on the left, we actually see areas of bone on this person that has more stress on their bones. So they have areas where muscles attach, you see, and that makes those bone areas create more bone material. Okay, fractures. Fractures are classified by cause and nature of a break. Here's classification by cause. So traumatic fractures occur because of injury. Spontaneous or pathologic fractures, these are caused by disease. We can also classify by the nature of the break. A simple or closed fracture. So this fracture is protected by the uninjured skin or mucous membrane. A compound or open fracture is when the bone is exposed to the outside through the opening in the skin. And we can also talk about different types of fracture classifications based on how the fracture occurs, such as a green stick fracture. That's an incomplete fracture. Here we have a fissured fracture, see down like the center. We have a comminuted fracture here where you actually have fragments created. A transverse fracture, that's a complete break. An oblique fracture is complete break also, but at a diagonal. And this shows a spiral fracture caused by twisting motion. Okay, we do have to repair these fractures. And we have different steps that we look at when we talk about fracture repair. The hematoma is the large blood clot that first forms. And it forms right after the fracture. Then you have the cartilaginous soft callus. The osteoblasts invade and produce spongy bone. The phagocytes remove debris. Fibrocartilage then is produced. Then a bone or a hard callus. The cartilaginous callus breaks down and the osteoblasts invade. Then the hard callus fills the space. In remodeling, bones are restored close to the original shape ultimately as the osteoclasts remove any excess bone that forms in the repair. In figure 7b here shows how that repair does occur and how you ultimately come back to the regular bone. Okay, fragility fracture, fracture that occurs after a fall from less than standing height. This shows a sign of low bone density in a person that gets this. Bone remodeling does occur throughout life, and with age, the osteoclasts remove more bone than the osteoclasts are able to deposit. Ultimately, that can result in osteopenia, or bone loss, and progressed osteoporosis. That's when you have severe bone loss. That'll leave real spaces, canals in the bone. It weakens them. It's estimated that 50% of women and 25% of men over 50 have one of the bone loss conditions. Most common, though, in postmenopausal women because of hormone changes. Now, to prevent the fragility fractures, they say to get 30 minutes of exercise per day, and this includes weight-bearing exercise. You need to get enough calcium and vitamin D, and do not smoke. That actually can lead to osteoporosis. This shows a comparison of normal bone to somebody with osteoporosis. Okay, the number of bones in the adult skeleton is about 206. Some people have extra bones while others lack certain bones. Examples of the extra bones that some people have are sutural bones, also called Wormian bones. These are found in sutures between the major skull bones. And then you have small sesamoid bones in the tendons. These reduce friction. And of course, the vertebra. Okay, this picture shows the sutural bones that you find that form as the different cranial bones form. Okay, table 7.3 goes through all the bones of the adult skeleton, and we're going to be going through each of these in these subsequent slides. Okay, when we talk about the axial skeleton, again, we're talking about all the bones down the center. So it includes the skull, the middle ear bones, the hyoid, the vertebral column, and the thoracic cage. The appendicular skeleton involves the pectoral girdle, so the scapula and clavicles, and then the upper limbs, the pelvic girdle, and the lower limbs. And again, as you can see, you have 206 total bones. The axial skeleton, there's 80 bones. This includes the skull, so that's the cranium and the facial bones. The middle ear bones, yes, you have a little bitty bones in the middle ear that help with sound. We'll talk about that when we get into the nervous system. The hyoid bone, that supports the tongue and is a muscle for the attachment. The vertebral column, that forms the central axis of the skeleton. And the thoracic cage, so the ribs and the sternum, they protect the organs. The appendicular skeleton, there's 126 bones. You have the pectoral girdle, which includes the scapula and the clavicle, and the upper limb movement is important for the pectoral girdle. The upper limbs, the humerus, the radius, the ulna, and hand. For the pelvic girdle, this includes the hip bones, the lower limb movement, and forms the pelvis. Then you have the lower limbs, which include the femur, the tibia, the fibula, the patella, and the foot. So this shows here in the orange color what we call the axial skeleton. And the yellow here are the appendicular bones. Now I have provided in your Moodle site a list of bones to know, and those are the ones I do expect you to memorize. They're the main bones. Actually, everything in this picture are bones that you definitely need to remember. Okay, so let's talk first about the axial. The hyoid bone, that's an interesting bone, which is right here at the top of the neck area of your skeleton. A lot of people don't even know about this bone. If you look at skeletons in laboratory, you'll see that structure kind of hanging down and outward right under the mandible. Now, as we go through many of these different bones, we're going to use a lot of different terms to name certain parts of the bone. So parts of the bones are also important as well as knowing the bone itself, because these are important connection structures quite often. And some of these are also listed on the bones to know part. But when we use the term condyle, we're talking about a rounded process that articulates with another bone, like the occipital condyle. Then you have a crest, that's a narrow ridge-like projection. Epicondyles, these are projections situated above a condyle. Facets, small or nearly flat surfaces. Fissures are clefts or grooves. Fontanelles, these are soft spots in the skull where the membranes cover the space between the bones. A foramen is an opening through a bone, often a passageway like for blood vessels or nerves or ligaments. A fossa is a deep pit or depression. A fovea is a tiny pit or depression. And a head of bone is an enlargement on the end of a bone. Okay, linea, this is a narrow ridge. Meatus, that's a tube-like passageway within a bone. A process is a prominent projection on the bone. A ramus, that's a branch or similar extension. A sinus, that's a cavity within a bone. A spine is a thorn-like projection. A sulcus is a furrow or a groove. A suture is an interlocking line of the union between bones. A trochanter is a relatively large process. A tubercle is a knob-like process. And a tuberosity is a knob-like process, usually larger than the tubercle. So let's start with the skull. The skull is typically composed of 22 bones. All skull bones are interlocked along sutures, except the lower jawbone, which is the mandible. The skull is the cranium and the facial bones. So the cranium has 8 bones. They enclose and protect the brain. The facial skeleton contains 14 bones, and they shape the face. The mandible is the movable part, and it's held in place next to the cranium by ligaments. Okay, ligaments connect bone to bone, where tendons generally connect a muscle to bone or other types of material. The orbit of the eye, that's formed by some of the facial and cranial bones. And then deeper down, we have the paranasal sinuses. Those are air-filled cavities in some of your cranial and facial bones. They reduce the weight of the skull, and they increase the intensity of the voice. Okay, so this shows some of the cranium and the facial. Okay, when we're looking at the skull, the frontal bone is the forehead, basically. Behind that, in purple, here's parietal. We'll show another picture. Then you have sutures that connect, and like the coronal suture. Okay, lacrimal bone right here at the interior of the eye, the ethmoid bone. Okay, at the sides of the head, you have the temporal bones. And you have the squamous suture that connects the parietal to the temporal. Sphenoid bone is this small bone here above the temporal, but also at the back of the orbit as we move down into the nasal area. So there's the nasal bone at the front. Down the middle, we have a perpendicular plate, which is a part of the ethmoid bone. Okay, you do have small openings here and there, like the infraorbital foramen and the mental foramen down here again for nerves and blood vessels. The vomer is another central area of the bone. Okay, the mandible is a movable part, the bottom of the skull. Okay, the sphenoid bone is one of the bones at the back of the eye orbit. Then you do have an opening of the eye for like the blood vessels and nerves, orbital fissure. Okay, the middle nasal concha at the back. Those are parts of the ethmoid bone. Zygomatic bone, which forms your cheeks. Another smaller bone at the back, the inferior nasal concha at the back of the nose. And the area of the bones above the mandible are the maxilla or maxilla. There's a few different ways people pronounce these different bones. Now, you don't have to memorize every single part here, so you'll want to memorize the ones that are on the list I've provided, the bones to know. But I still will go through them because it's important to have heard them and recognize them. Side view, again, you see the parietal bone here, you see the frontal bone, and it's divided by the coronal suture. Now you can see the temporal bone better. And at the back of the head, you have the occipital bone. Okay, some important processes or parts, the external acoustic meatus, which goes into the ear. Okay, mastoid process. The bottom of the skull, you'll see this important when we talk about connections with the vertebral column. Okay, at the top of the mandible, connectors to the other parts of the skull, like the mandibular condyle, where it fits into the temporal bone at the zygomatic process, and the coronoid process here at the top and front or anterior of the mandible. Okay, lots of small bones at the back of the orbit of the eye. I don't require you to memorize those. It is important to point out, though, that a lot of these smaller bones also form the sinuses of the skull, the face. Here we have the frontal sinuses. Okay, so those are cavities in the bone. Below that, the ethmoidal air cells. Okay, then the sphenoidal sinus, and then you see the maxillary sinus. Now, not everybody has all these sinuses, or they're different sizes in different people, which do impact the resonance of a person's voice. Okay, looking at the cranium, the frontal bone. It forms the forehead, the roof of the nasal cavity, the roofs of the eye orbits. It contains the frontal sinuses. It contains the supraorbital foramen, or the notch. The parietal bones that are behind the frontal bone, they form the sides and roof of the cranium. Sagittal suture joins the two parietal bones. Then the coronal suture joins them to the frontal bone. The occipital bone at the back forms the back of the skull, the base of the cranium. Contains a foramen magnum. That's the big opening at the bottom for the brain to meet the spinal cord. Then you have occipital condyles that articulate with the atlas. You're going to see this word used a lot, articulate, which means connection. Another name for an articulation is a joint. Okay. The atlas is the very top vertebra of the spinal cord. The lambdoid suture, it forms the junction with the parietal bones. Okay, this shows the bottom of the skull. This shows that large foramen magnum we were talking about. The occipital condyles are areas that fit on top of the vertebral column at the atlas. That's that first vertebra. Okay, I'm not going to go over every one of these parts. You don't have to know all of them, but it's helpful to go over them yourself. You'll go through these parts in your laboratory also. Okay, the temporal bones, they form the sides and base of the cranium and the floors and the sides of the orbits. The squamous suture connects them to the parietal bones. The external acoustic meatus leads to the inner portion of the ear. The mandibular fossa articulates with the mandibular condyles. The mastoid process, this is where a muscle attaches. Styloid process is also where a muscle attaches. It helps in movement of like the mandible. The zygomatic process helps form the cheek prominence and the zygomatic arch. The sphenoid bone, it forms the base of the cranium, the sides of the skull, the floors and side of the eye orbits. The saliturca holds the pituitary gland, and the sphenoid bone contains the sphenoid sinuses. The ethmoid bone, it lies in front of the sphenoid. It forms the roof and walls of the nasal cavity, the floor of the cranium, and the wall of the eye orbits. The cribriform plates contain the openings for axons of the olfactory neurons. The perpendicular plate forms the main portion of the nasal septum. The superior and middle nasal concha support the mucous membranes of the nasal cavity. The ethmoidal air cells together form the ethmoidal sinuses, and the crista galli holds the membranes that enclose the brain. Okay, and this shows that part at the bottom of the cranium that looks kind of like a butterfly. You don't have to know all of these parts of that particular bone, but again, it's an important bone because it contains some important features. This shows the internal structure, lateral wall of the nasal cavity. It's just kind of important to point out because you can see how it does form the nasal cavity and some of the sinuses. And you have a lot of mucous membranes that line these areas that are important. Okay, this shows the floor of the cranial cavity. Again, shows some very important features like the sella turcica where the pituitary gland sits. As you can see, there's lots of different openings that have many different purposes. Okay, the facial skeleton is composed of 13 immovable bones and one movable bone, which is the mandible. The maxillae, there's two of those really. That's the upper jaw above the mandible, anterior roof of the mouth, and the hard palate, floors of the eye orbit, the sides and floors of the nasal cavity. There are important alveolar processes that hold the upper teeth. The maxillary sinuses are the largest sinuses you have. Okay, the palatine processes, they fuse along the midline to form most of the hard palate. Cleft palate is a situation where you have incomplete fusion of the palatine processes during the fetal development. So you've probably heard of people with cleft palate. Palatine bones, you have two L-shaped bones located behind the maxillae, posterior section of the hard palate, and the floor and lateral walls of the nasal cavity. The zygomatic bones, of which there's two, these form the prominences of the cheeks, lateral walls and floors of the orbits, and the temporal process joins the zygomatic process to form the zygomatic arch. Two lacrimal bones, they form the medial walls of the orbits. They contain the grooves that lead from the orbit to the nasal cavities for the tears. Okay, there's two nasal bones. Together they form the bridge of the nose. Long, thin, rectangular. The vomer bone, that's along the midline of the nasal cavity, and it forms the inferior part of the nasal septum. And then the inferior nasal conchae, these are scroll-shaped bones. They extend inward from the lateral walls of the nasal cavity. They're the largest of the conchae, and they support the mucous membranes of the nasal cavity. And those are shown here. And this is a frontal section of the skull. Again, shows many of those bones and bone parts we just talked about in some of the sinuses. Okay, the mandible, it's the lower jawbone. It's a horseshoe-shaped body, has ramuses that project upward on each side. The mandibular condyle articulates with the mandibular fossa, and the coronoid process attaches to the chewing muscles. The alveolar processes here hold the lower teeth. The mandibular foramen, they admit the blood vessels and nerves for the lower teeth, and the mental foramen allows blood vessels and nerves to emerge in the chin area. And this shows those different parts of the mandible. Okay, the infantile skull has incomplete development at birth. Small face, large orbits, prominent forehead, small nasal cavity and jaw. The sinuses are not completely formed, and the bones are thin and flexible. The fontanelles are the soft spots of the head, fibrous membranes that connect the cranial bones together, and where the intramembranous ossification is incomplete. They allow the skull to change shape slightly during birth, and you have four major fontanelles close between 2 months and 2 years of age. So this shows those areas. So this helps the child, basically, its head fit out the birth canal. So the head can kind of squeeze out a little bit. Often when a child is first born, their head, it seems misshapen because it's been squeezed out, but it always comes back to normal. Okay, moving on, the vertebral column. It forms the vertical axis of the skeleton. It consists of many vertebrae that's separated by cartilaginous intervertebral discs, that is a fiber cartilage, and is connected by ligaments. It supports the head and trunk. It permits several types of movements and protects spinal cord and the vertebral canal, of course. There's 33 separate bones in the infant and 26 in the adult. When we talk about the vertebral column, we divide it into 4 curvatures. The cervical curvature is secondary, the thoracic curvature is primary, the lumbar curvature is secondary, and the sacral curvature is primary. But these curvatures start at basically right below the head, so the neck, cervical, thoracic into the thoracic region. Lumbar is like lower back, and even lower down is the sacral curvature. Okay, the vertebral column consists of 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fused sacral vertebrae, which form the sacrum, and 4 fused coccygeal vertebrae, which form the coccyx. And one reason why the adults have fewer vertebral bones is because they do fuse eventually. Okay, one way to remember the number is breakfast, lunch, dinner. So 7, 12, 5. Breakfast, lunch, dinner. Okay, this shows those curvatures. There's the cervical, there's the thoracic, there's the lumbar, and then the sacral at the bottom. Okay, again, 7, 12, 5. Typical vertebra has these parts: a body, which is a drum-shaped anterior portion. That's the largest part. The pedicles, these are stalks that project from the body, and they form the sides of the vertebral foramen. The laminae, these are plates that arise from the pedicles, and they fuse to become the spinous processes at the back. The spinous process is the posterior projection. That's what you feel at your back if you rub your hand down the center. Transverse processes, these are lateral projections to the side. The vertebral foramen, that's the opening all through the vertebrae which have the spinal cord in it. You have the superior and inferior articular processes. They project upward and downward, and they articulate with each adjacent vertebrae. So they sit on top of each other. The facets, these are cartilage-covered articulating surfaces of the articular processes. Okay, so this shows your typical vertebrae. There's the body, the pedicles, okay, the articular facets. Then you have the spinous process, transverse process, and the lamina. And this shows how those bones fit together. Okay, as you can see at those articular processes, they will fit on top of an articular facet. Okay, the 7 cervical vertebrae, they're found in the neck region. They're the smallest vertebrae. The transverse foramina, these are openings for the arteries leading to the brain. These are only found in the cervical vertebrae, and I'll show you a picture here in a minute. Also, one way you know it's a cervical vertebrae is they have bifid spinous processes, so they divide into 2 little prominent parts. Then the vertebral prominence, C7, that's the spinous processes longer than those of the other cervical vertebrae. The atlas, C1, that is the first vertebra. It supports the head. It articulates with the occipital condyles, and it's called the atlas because of the Greek figure who had the earth on his back, carried it. The axis is right under the atlas. It's called the axis because it actually pivots. That allows you to move your head in the no kind of formation. Okay, so this shows that cervical vertebra. Notice that they do have transverse foramina in the transverse processes. Again, that's for those blood vessels and nerves to come up through into the head. You don't see that in thoracic or the lumbar vertebrae. Also, we were talking about the spinous process being bifid or bifid. So you see it divides. Okay, in the thoracic and lumbar, it's just one prominent spine. Okay, the 12 thoracic vertebrae, they're found in the chest region. They're larger than the cervical vertebrae. They articulate with the ribs. Their long and pointed spinous processes are pretty obvious, and they slope downward, and that's important. The 5 lumbar vertebrae, they're found in the small of the back. They have very large bodies because they bear most of your weight, and they have thick, short spinous processes that are almost horizontal. And this shows the difference in those different vertebrae. As you can see, they get larger as you move downward. Also, the spinous processes, as you can see, it's more downward in the thoracic vertebrae. And again, larger or thickened bodies, as well as spinous process in the lumbar. Now, one way to notice the difference in the thoracic and the lumbar is the difference in the size of the body. But if you look at those processes, or if you look at the spines at the back, the posterior portion, this one, the thoracic often looks like a giraffe, and the lumbar often looks more like a moose. Okay, the sacrum, triangular structures at the base of the vertebral column. Typically, there's 5 fused vertebrae. You have the median sacral crest, that's the fused spinous processes of the vertebrae. Then you have the posterior and sacral foramina. Those are openings for the blood vessels and nerves. Okay, also at the sacrum, we form the sacroiliac joint, which transmits the body weight to the legs. Also, it forms a posterior wall of the pelvic cavity. The sacral promontory is a projection at the upper margin. The sacral canal is formed by the vertebral foramina. The sacral hiatus is an opening at the inferior tip of the sacrum. And then at the very bottom, the coccyx. This is what we call the tailbone. So usually contains 4 fused vertebrae, and they fuse between the ages of 25 and 30. So this is the sacrum, what we were just talking about. See, there's actually a sacral canal that goes down the center that had connected those openings in the other vertebrae, those vertebral foramina. And then, of course, the coccyx at the bottom. Okay, you may want to look at table 7.8 when you get the chance. It goes through the different features that we have just gone over. A lot of disorders occur of the vertebral column, herniated or ruptured discs. That's where you have a break in the outer portion of the intervertebral disc. Compresses your spinal nerves. It causes numbness, pain, loss of muscle function. And these intervertebral discs are in between each of the vertebrae. Intervertebral means between the vertebrae, and that is fibrocartilage between each of your vertebrae. Spondylolisthesis, this results from the vertebra sliding out of place over the vertebra beneath it, very painful. A kyphosis, this is an exaggerated thoracic curvature of the spine. You have rounded shoulders and hunchback in these individuals, and it is caused by poor posture or injury or disease. Scoliosis, that's an abnormal lateral curvature of the spine. One shoulder or hip can be lower than the other, leading to compression of the visceral organs. Lordosis, this is an exaggerated lumbar curvature of the spine, also called swayback. You can have compression fractures. This is where fractions of the vertebral bodies become more common with age. Well, let me try that again. Fractures of the vertebral bodies do become more common with age, and this is a compression fracture because the invertebral discs get much more rigid. They start shrinking. The back can actually bow up a little bit, because, and that may be caused by accentuated curvatures also. Okay, the thoracic cage. This includes ribs, thoracic vertebrae, the sternum, and the costal cartilage that attach the ribs to the sternum. It supports the pectoral girdle and the upper limbs. It protects thoracic and upper abdominal viscera, and has a very important part in breathing. You'll learn more about that when we talk about the respiratory center in 169. Humans have 12 pairs of ribs. We have what's called the true ribs, or vertebrosternal ribs. There's 7 pairs. They connect directly to the sternum. Okay, but they do connect through a cartilage, though. I'll say. The false ribs, there's 5 pairs. The vertebrochondral ribs, they're the upper 3 pairs. Costal cartilage do connect through cartilage number 7. So they don't each have their own cartilage. And then you have the floating ribs, which have no connection to cartilage. That's the lower 2 pair. Okay, structure of the ribs, you have a shaft, which is your main portion. They're long and slender. The head portion, or the posterior end, articulates with the vertebrae. Tubercles, they articulate with the vertebra. The costal cartilage, that is hyaline cartilage, and it connects the rib to the sternum. Okay, so you see the cartilage I'm talking about here. Okay. And again, once, let's say we have true ribs here where each of them have their very own cartilage connection, but then you get down to false ribs where the cartilage connects to another cartilage, or the last 2, which are floating ribs, which are not connected to cartilage at all, and therefore not connected to the sternum. Okay, these are the different ribs, and notice how they connect. You have the anterior end here that connects to a cartilage, which then connects to the sternum, the shaft. And then at the back, notice that the ribs actually connect at 2 places to that backbone. At one place, it's actually connecting to like the transverse foramen, or I'm sorry, the transverse processes, I should say, where the facet combines to the tubercle, and then at the front to the actual body of the vertebra. Here we have the head connecting to a facet of the vertebra. Okay, the sternum, also called the breastbone, that's along the midline of the anterior thoracic cage. There's 3 parts: the manubrium, which is the upper part, the body, which is the middle and largest part, and then the xiphoid process, which is the lower part. The sternum articulates with the costal cartilages of the ribs and the clavicles. Okay, the pectoral girdle now. This consists of the 2 clavicles and 2 scapula. So the pectoral girdle is just 4 bones. The clavicles are also called the collarbones. Those are the anterior portion. And then you have the scapulae, which are the shoulder blades, the posterior portions. It forms an incomplete ring that's open in the back. It supports your upper limbs. And here we have the attachment sites for muscles that move the upper limbs. Okay, so there's the clavicle and there's the scapulae. Notice how they articulate with the humerus of the arm. And notice how the scapula itself articulates with the clavicle, and how the clavicle articulates with the manubrium of the sternum. Okay, the clavicles are S-shaped. They articulate with the manubrium and scapulae. They brace the scapulae, and they are freely movable. The attachments are found here for muscles of the chest, back, and upper limbs. The scapulae, the broad, thin, triangular bones in the upper back. Okay, the spine, that's a divided posterior surface into 2 parts. Supraspinous fossa, which is a depression above the spine, then for spinous fossa, which is a depression below the spine. The acromion process, that's the tip of the shoulder. The coracoid process attaches to the upper limb and chest muscles, and the glenoid cavity or fossa is what articulates with the head of the humerus. Okay, so that's your scapula. Notice the glenoid cavity here, that is where the humerus articulates. Okay, the acromion process is going to be the part that articulates with the clavicle. Okay, the upper limb bones, they form the framework of the upper arm, the forearm, and the hand. They provide the muscle attachments. They work with muscles for the limb movement. Bones of the upper limb include the humerus, the radius, the ulna, the carpals, the metacarpals, and the phalanges. Okay, so there's your humerus, ulna, the radius, carpals of the wrist, metacarpals of the hand. The phalanges are the fingers. Okay, the humerus, that's the only bone of the upper arm. The head, the greater tubercle, the lesser tubercle, anatomical neck, surgical neck, deltoid tuberosity, the capitulum, the trochlea, the lateral epicondyle, the medial epicondyle, the coronoid fossa, and the olecranon fossa are different parts of the humerus. And you see those parts here looking at the humerus. Again, this is the upper arm. Okay, and you can feel on the side of your humerus, the part that pokes out a bit, the greater tubercle, the part to the front of the arm is the lesser tubercle. The deltoid tuberosity is a little bit of an enlargement to the side of the bone. Of course, the head of the bone, the part that articulates with the shoulder blade. Okay, looking downward, moving down at the bottom, we have the coronoid fossa, which is kind of an indention of the lateral epicondyle that pokes out to the side that you can feel when you feel to the side of the bottom of the humerus, and the capitulum, which is this area to the side of the trochlea, which articulates with the lower arm bones. And you have a lateral epicondyle also to the middle or towards the inside of the body that you can feel if you palpate the bone at the bottom there. Okay, the radius, that's a lateral forearm bone. It's shorter than the ulna. It has a head, a radial tuberosity, a styloid process, and an ulnar notch. And so the radius is on the thumb side, and there's a saying that's supposed to help you remember where it is, that I cut my thumb off with a radial saw. Again, the thumb is on the radius side, or the radius is on the thumb side, I should say. The ulna is the medial forearm bone on the inside, the pinky side. It's longer than the radius. It has a trochlear notch, an olecranon process, a coronoid process, a radial notch, a head, and a styloid process. Again, you only have to know the parts that's on the list I've provided to you, the bones to know. Okay, and again, notice that the ulna is the bone that actually articulates with the humerus, and it articulates at the trochlear notch. The part of the humerus that articulates is called the trochlea, so that kind of makes sense. Okay, here you have the radius. The radius actually does not articulate with the humerus. And let's see, important points at the bottom of the radius is the styloid process to the side at the bottom. You can feel the styloid processes too right before you reach your hand, right before you reach the carpal. So if you feel on either side, you've got a process, a styloid process of the radius and a styloid process of the ulna. Okay, moving down to the wrist, you have 8 carpal bones. You don't have to memorize those. Scaphoid, lunate, triquetrum, the pisiform, the hamate, the capitate, the trapezoid, and the trapezium. Then you get to the bones of the hand itself, which are the metacarpals, and then the fingers, which are the phalanges. And we name the phalanges based on where they are. The proximal phalanx, which is singular for phalanges, is the one that's going to be closer to the hand. The distal phalanx is the one that's furthest away. So that's the bone at the very end of your fingers, the distal. Okay, and notice that the thumb only has 2 phalanx, okay, or phalanges. So it shows the distal, the middle, and the proximal phalanx. Okay, the pelvic girdle consists of 2 hip bones that has a coxal, pelvic, or innominate area that we can also refer to them. The pelvis is the pelvic girdle plus the sacrum plus the coccyx. The pelvic girdle supports the trunk of the body, protects the viscera or the organs like the urinary bladder, transmits the weight to the lower limbs, and provides attachment for lower limbs. Okay, and as you can see, so we have these two sides basically of the pelvic girdle, which we can actually divide into the ilium, into the ischium, and the pubic bone here at the front. So pubic or pubis, ischium, ilium. Okay, the ilium has important parts on it: the iliac crest, the iliac spine, the greater sciatic notch. The ischium supports the weight while you're standing, has ischial spines and ischial tuberosities. The pubis is the anterior portion, which forms the pubic symphysis at the front and the pubic arch. Now, on the hip bone, you have the acetabulum. This is a depression where the head of the femur articulates with it. Then you have the obturator foramen, which is the opening between the pubis and the ischium. Okay, here's this opening, since we just mentioned obturator foramen. You don't have to know all of these parts of the hip bone. Okay, sometimes we refer to different parts of the pelvis as the false or the true pelvis. The false pelvis is the upper or the greater part. It's superior to the pelvic brim. It's bounded by the lumbar vertebrae posteriorly. It's bounded by the iliac bone laterally. It's bounded by the abdominal wall anteriorly, and it helps support the abdominal organs. The true or the lower lesser pelvis is inferior to the pelvic brim. It's bounded by the sacrum and the coccyx posteriorly. And it's bounded by the lower ilium, the ischium, and the pubic bones laterally and anteriorly. The female and male pelvis are a bit different. The female pelvis does function as the birth canal. The iliac bones are more flared. There are broader hip bones than the male. Pelvic cavity is wider than the male. The pubic arch angle is greater. There's more distance between the ischial spines and the ischial tuberosities. The sacral curvature is shorter and flatter, and it's lighter in weight. The male pelvis is less flared and heavier in weight. Okay. And do notice what we consider the true versus the false areas, okay? Okay, the lower limb bones, they form the framework of each thigh, leg, and foot. Bones of the lower limb include the femur, the patella, the tibia, the fibula, the tarsals, the metatarsals, and the phalanges. Okay, so there's the femur, patella, tibia, fibula, tarsals, metatarsals, phalanges again. Ways to tell the difference in tibia and fibula. Tibia is larger than the fibula, and I've seen it written to say compare the tibia to the tuba and the fibula to the flute. Don't misspell these, get them mixed up, because often I see on people's tests they'll write tibula and fibia, but do notice it's fibula and tibia. Notice that the femur articulates with the tibia, not the fibula. The fibula just attaches to the tibia at the top. Okay, and it's the condyles that will articulate with the femur. Okay, let me try this again. The femur is the largest bone of the body. Parts of the femur include the head, the fovea capitis, the neck, the greater trochanter, the lesser trochanter, the linea aspera, the medial and lateral condyles, and the medial and lateral epicondyles. Okay, so you see it has a real prominent head on it, and you shouldn't confuse this with the humerus of the upper arm, because it has just a real prominent neck. It's a much larger bone. Okay, the greater trochanter are some of the parts you feel at your side. If you feel at the top of the leg, Then you have the major shaft. And then at the bottom, you have some prominent parts like the lateral epicondyle and medial epicondyle, which you can feel if you feel the sides of the lower femur. And then you have these prominent processes, which are the medial condyle and lateral condyle that articulate with the bone below it. Do notice they are covered with a hyaline cartilage. In between the condyles, you have the intercondylar fossa. Okay, the patella, it's a flat sesamoid bone that's located in the quadriceps tendon. It's at the anterior surface of the joint, and it helps with lever actions with movement of the lower limbs that we'll talk about later on when we talk about articulations or joints. Okay, the tibia, that's also the shin bone. It's the larger of the two leg bones. It lies medial to the fibula. You have condyles at the proximal end. The tibial tuberosity is the attachment site for the ligament, and the medial malleolus is a major part of the tibia as well. The fibula is a long, slender bone, lateral side of the tibia. It's non-weight bearing, has a head and a lateral malleolus. Okay, so this shows you the tibia and fibula and those major parts. Again, at the top of the tibia, you have the condyles, the lateral and the medial condyles. At the front, where you find, if you reach down for the shin bone, the tibial tuberosity, the anterior crest, that's what you feel. At the bottom, you have the medial malleolus. Okay, moving downward, the tarsals, those are basically the ankle bones. The calcaneus is your heel bone. The talus is a major bone that articulates with the tibia. The navicular, the cuboid, the lateral cuneiform, the intermediate cuneiform, and the medial cuneiform. The metatarsals are the foot bones. There's 5. Then you have the phalanges, okay, the toe bones. There's 14 of those. And believe it or not, you actually have proximal, middle, and distal phalanges. Okay, so this shows the calcaneus, which is that heel bone. Here's the talus that articulates with the tibia. Then you have those different metatarsals. I'm sorry, tarsals, metatarsals, let me say, and then the phalanges. And this is another view of those bones. So tarsals of the ankle, metatarsals of the foot, phalanges, the toes. And notice the big toe only has 2 phalanx. Okay, what happens to your bones with time? Well, you decrease in height, and this actually begins at the age of 30. Your calcium levels fall, the bones become brittle and more prone to fracture. The osteoclasts outnumber the osteoblasts, and therefore you're breaking down bone. Spongy bone weakens before the compact bone does. You have bone loss that's rapid in menopausal women. Hip fractures tend to be more common, and you have vertebral compression fractures that tend to be fairly common. All right, and that's that for the skeletal system. The next chapter will deal with articulations and how these bones fit together and how you move those different parts. All right, as always, if you have any questions, feel free to let me know.